Mandatory Vaccination Reporting. Let's have a look. Hello everyone, Florian.Heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee and let's have a look at this release from the Australian Government, the Department of Health. So they're proposing amendments to the Australian Immunisation Registry Act of 2015. So this will concern a lot of people, and there is an opportunity for you to make a submission or at least answer an online survey until tomorrow. I just found out about this today thanks to someone who left it as a comment, and I thought I should draw attention to it. Now, I believe in the value of vaccination, but I also believe people should have a right. And my concern is what's going to happen. The potential of what could happen is that businesses will start discriminating based on your vaccination record. Can you see that happening? You know, fine. If they want to give businesses that right, give them that right, but then allow businesses to discriminate for everything they choose. But you know that's not going to happen, don't you? No. So, changes to the Australian Immunisation Register legislation. We're seeking feedback on proposed changes to the Australian Immunisation Registry Act 2015, the AIR Act. The proposed amendment to the AIR Act is to make it mandatory for all recognised vaccination providers to submit vaccines to the Australian Immunisation Register. The proposed legislative change will not make having a vaccination mandatory. Rather, it will be mandatory for vaccination providers to report that vaccines have been administered. Your feedback will help the department ensure that changes made to the Australian Immunisation Register Act 2015 align with community and stakeholder expectations. A link to the consultation paper can be found below. Feedback through this consultation process can be on any aspect of the proposed change. Why we're consulting. The purpose of this consultation is to seek stakeholder and community feedback on the proposed legislation changes. Submissions will be considered when developing the bill that will be introduced to Parliament. So let's go through this consultation paper. Amendment of the Australian Immunisation Register Legislation Consultation Paper, November 2020. I mean, when did this come out? When was this released? Okay, so it's only 10 days. A 10-day opportunity for you to make a submission to this. Is that enough? About this change. The Australian Immunisation Register is a national register that is able to record all vaccines given to all people in Australia. The AIR includes vaccines given under the National Immunisation Program, through school programs, and privately, such as flu or travel. The AIR is administered under the Australian Immunisation Register Act 2015. Currently, vaccination providers are encouraged to report all vaccines administered to the AIR. However, as reporting is voluntary, not all vaccines administered are reported. Well, as a patient, are you able to request that it isn't reported? What if you don't want it reported? That is someone's individual choice. My understanding is that shouldn't the patient have complete control over their records and the information they're provided? Maybe that's an old-fashioned concept, you know, individual rights. This means people may not have a complete record of the vaccines they have received. Having a complete record on AIR helps avoid unnecessary revaccination. Individuals and their vaccination providers know what vaccines they have had and when they are overdue. Families show they are eligible for family assistance payments and/or attendance at early childhood education. And health authorities and professionals to manage outbreaks of vaccine-preventable diseases. I don't know if it already will, but I guess that you could get an appreciation if there's a low vaccination rate for certain populations and regions, perhaps. The majority of vaccination providers already report childhood and adolescent vaccines to AIR. In 2019, over 90% of childhood diphtheria, tetanus, pertussis vaccines were reported to AIR, but there is a significant gap in the number of adults and privately purchased vaccines reported. I think, what was the last stuff? I mean, I'm glad I got a tetanus vaccine. That's good when I'm cutting myself on rusty nails. You know, just look up what used to happen to people when they got that. That's horrific. So what would change? All vaccination providers will be required to report vaccines administered to all individuals in Australia in the air at the time of vaccination. Reporting to the air should be electronic and include all relevant information such as Medicare number and reference numbers if Medicare eligible, and any other vaccination details required for complete reporting. This may include national, individual and provider healthcare identifiers and vaccine batch and serial numbers. For the purposes of the AIR Act, recognised vaccination providers are endorsed by the Commonwealth, state or territories or administer vaccines in Australia for the purposes of AIR. Recognised vaccination providers include medical practitioners, Aboriginal health workers, Aboriginal health services, commercial providers, community health services, councils, flying doctor services, hospitals, pharmacies, public health units, medical practices. What will not change? This proposed legislation will not make it mandatory to receive a vaccine. It will only be mandatory to report that a vaccination has been given. Well, I just see that as more paperwork for doctors. This proposed legislation change will not change the way in which personal data is protected. Immunisation information recorded on air will continue to be held in accordance with existing requirements under the AIR Act, which allows the disclosure of information to Commonwealth authorities, which allows Services Australia and Health to administer and manage the air. Prescribed bodies, including state and territory health departments, which allows them to manage and implement their vaccination programs, and recognised vaccination providers, which allows them to confirm an individual's vaccination history before giving them a vaccine. When will this change happen? It is proposed, this all sounds well and true, but what's saying that that isn't changed in the future? Maybe you can pay a subscription fee for your business to mitigate risk, or people will start to have to get access to it to get access to businesses. Is this the type of world that we want to live in, everyone? That's steadily where it could head. I wouldn't be shocked. So when will this change happen? It is proposed that implementation of mandatory reporting to the air will be a staged approach, with the mandatory reporting of COVID-19 vaccinations, should a safe and effective vaccine meet all necessary regulatory requirements for supplying the Australian market, and influenza vaccinations from the 1st of March 2021, and all NIP vaccinations from the 1st of July 2021. This will allow time for vaccination providers to investigate software options to report, and for those whom software is not cost beneficial, to seek support from Services Australia to report directly to AIR using the AIR site or government provided channels. What will happen if vaccines aren't reported? Various compliance options are being explored and stakeholder views are sought on what might be considered appropriate. Potential measures could include the following, noting it could be a combination of one or more of these options in a progressive manner. Education and support. A non-punitive approach enabling the Secretary, Department of Health, or the Chief Executive Officer of Services Australia to direct specific persons to attend vaccination premises to provide education and training to non-compliant vaccination providers. Public disclosure of vaccination providers who fail to report. So, training and shaming. Implementation of a legislative mechanism that would require the Minister for Health to report to Parliament of numbers of providers reporting to AIR and potentially drawing attention, public disclosure, to vaccination providers who fail to report as mandated. Suspension of provision of NIP vaccines. This approach would involve state and territory health departments being obliged to report to the Commonwealth on the vaccines supplied to vaccination providers. Distribution of vaccines to providers for state and territory health departments would be compared with vaccines reported to AIR. Supply of NIP vaccines could be suspended to those vaccination providers identified as failing to report vaccinations to AIR, even after education and support has been provided. So if you've been shamed and trained, you may lose this revenue stream. Exemptions and alternative remediations may be considered for providers in remote regions, as they may be the only source of NIP vaccinations. Penalty provisions. A civil penalty could be prescribed if a vaccination provider does not mandatorily report, even after education and support has been provided. How do you feel about doctors reporting procedures back to a central authority, to the state? Shouldn't it be? Nowhere here is it even saying the patient has the choice. It is intended that compliance activities be flexible and discretionary to manage individual circumstances where vaccinations should not be reported to AIR. A history of AIR. The Australian Immunisation Register commenced in 1996 as the Australian Childhood Immunisation Register, gathering information on all vaccines given through the National Immunisation Program to children under the age of 7 years. The ACIR was expanded to become a whole-of-life register and renamed the Australian Immunisation Register in September 2016. Under Section 10.1 of the AIR Act, the purpose of the register include monitoring the effectiveness of vaccines and vaccination programs, including adverse events, identifying any part of Australia at risk during disease outbreaks, informing immunisation policy and research, proof of vaccination for entry to childcare and school and for employment purposes, monitoring vaccination coverage across Australia and determining eligibility for the family tax benefit and the childcare subsidy payments. So there we have it, everyone. What's your take on it? Yeah. I don't like the idea of potentially shaming medical practitioners, that I know that's not what they call it, publicly disclosing those who fail to report. It's going to be more paperwork. I can understand the argument behind it, but you would expect there to be at least some consideration for the, well, choices of the patient. I wonder if all those vaccinations I got for my trips overseas on my honeymoon, wonder if they're recorded on there. You know, what do you reckon? What do you think, guys? Do you think it's an issue? Or do you think it's just something that's sensible? Well, this is your opportunity to have your say, at least until tomorrow. If you see anything like this where there's a government opportunity to give feedback or you'd like to draw some attention to it, please let me know or send me an email in the comments. I would like to encourage people to take part in the political process and to have their say on government calls for input. One thing I suggest, don't do the whole standard bog letter thing. Copy and paste letter, or here's a template letter, just copy and paste it. They're all dismissed as one submission. Generally, in other things I've seen, public consultation for projects, it's all considered one submission. So when the Citizens Party or something like that, when they put like a campaign together, they may be considered as one, even if they get thousands of people. Take the time to do your own. So there you have it, guys. If you're in favor of this is your chance to share that opinion. If you're concerned with it, or if you'd like to at least have the option for patients to limit the data that's provided, maybe only, I would be happy, frankly, personally, I don't care if it's provided to say when I get immunization, it's on there. I don't really mind. But I can understand what if people wanted to protect their privacy. I can appreciate that right. If they're concerned it's getting out there more. If businesses eventually or government eventually uses this to discriminate against people. What if we could have just as effective saying just the location and the immunization? So then you realize when you've had a certain number of them, they've accounted for, and then it's not possible to link it back to a person. That's probably a better solution. What do you reckon? Anyway, guys, let me know your thoughts and opinions in the comments down below. Please like, share, and subscribe to the channel. If you're a fan and want to support the content I create here, there are a few ways you can. You can join us on YouTube or Patreon. You can support us using our affiliate links at Amazon, eBay, Independent Reserve, or Kucoin. You can buy merch from HeiseSays, use Gold Pass from the Perth Mint, or support us via PayPal. Take care, everyone. Have a great day, and I'll see you next time.